Welcome to this explainer, where we're going to treat the human brain like the ultimate decryption puzzle. We're diving right into a medical revolution that is quite literally turning a simple blood draw into a biological decoder.
Imagine a high-stakes techno-thriller, where we no longer need invasive, deeply uncomfortable procedures to access the underlying code of cognitive decline. What if solving the Alzheimer's mystery really could start with just a simple finger prick? Honestly, it sounds a lot like science fiction. But today, we're going to explore the clinical realities and the scientific breakthroughs that are making this possible right now.
So here is our decryption sequence for today. We're going to look at the rule-out revolution, the relay hypothesis, the ratio effect, differentiating the dementias, the Alzheimer's clock, and finally, some necessary guardrails in human progress. Let's get into it.
Part 1. The rule-out revolution, or as it's known in the clinic, the triage protocol.
We're going to start with some immediate, incredible good news, which is our shift away from the really expensive, invasive hardware of the past. Historically, looking for Alzheimer's meant ordering incredibly pricey PET scans or, even worse, subjecting patients to painful cerebral spinal fluid spinal taps. But we are stepping into a highly accessible future. This is being driven by tools like the newly FDA-cleared Elecsys p-Tau 181 plasma test, which is specifically designed for the primary care setting.
Now, here's the crucial point you need to understand. The Elecsys test isn't a definitive yes or no diagnostic tool for Alzheimer's. Instead, it's designed for symptomatic patients aged 55 and older as a highly sensitive triage tool. Its main job is to effectively rule out amyloid pathology. This means it helps primary care doctors quickly identify who does not have Alzheimer's. This spares those patients from all that unnecessary, invasive testing and points doctors toward other possible causes of their cognitive decline much faster. It's a total game changer for standard clinics.
Okay, moving to part 2, the relay hypothesis, which is all about the protein hierarchy.
To really grasp the underlying code of this system, we have to talk about phosphorylated tau, or p-tau isoforms. Basically, these are specific biomarker proteins found in the blood that rise sequentially at different stages of Alzheimer's disease progression. You can kind of think of these p-tau markers as specialized sensors or alarms in a building, with each one perfectly calibrated to detect a different level of threat in the brain at a completely different time. The scientific literature actually calls this the relay hypothesis. It's fascinating. About 20 years prior to any symptoms, p-tau 231 triggers the earliest warning. It acts as a preclinical smoke detector, often rising before amyloid plaques even show up on a brain scan. Then, the relay continues. About 3 to 4 years prior to diagnosis, right as patients hit mild cognitive impairment, p-tau 217 takes over. This is your fire monitor. P-tau 217 has really emerged as the absolute gold standard for diagnosis and staging. It's so effective, in fact, that older markers like p-tau 181, which used to be the go-to standard, are now seen as largely less effective for high-precision staging compared to 217.
Part 3. The ratio effect, or how we're democratizing data.
So now we reach the algorithm itself. Getting the absolute most accurate biological read used to rely on incredibly expensive, top-tier laboratory hardware, like mass spectrometry. But scientists realized something brilliant. By using automated code, specifically immunoassays that measure the ratio of p-tau 217 to another protein called A-beta 42, they could achieve massive leaps in accuracy, but without the massive price tag.
Why a ratio, though? Well, measuring a ratio rather than just a single, isolated protein essentially normalizes the data. It accounts for all those tricky individual differences in how our unique bodies clear out proteins. It also mitigates confounding factors like, say, if a patient happens to have chronic kidney disease. So it acts as a great equalizer. It allows cheaper, automated clinic tests to literally match the performance of those gold standard, highly expensive lab benchmarks.
Part 4. Differentiating the Dementias, which is essentially our sorting algorithm.
The beauty of this system's precision isn't just about finding Alzheimer's. It's also about identifying entirely different neurological threats. Out in the real world, doctors frequently have to differentiate Alzheimer's disease from other conditions, like frontotemporal lobar degeneration, or FTLD. Now, these two conditions can present with overlapping symptoms that look really similar on the outside, but they require entirely different therapeutic treatments. So accurate differentiation is absolutely critical. And recent research reveals a really elegant solution here. By taking neurofilament light chain, or NFL, which acts as a general marker of neuronal damage, and combining it with our gold standard p-tau 217 into a ratio, doctors get vastly superior accuracy in distinguishing these specific dementias. This specific ratio easily outperforms relying on any single biomarker on its own. It's a phenomenal sorting tool.
Part 5. The Alzheimer's Clock. We are moving from diagnosis to prognosis.
This is where things get truly futuristic. We're shifting from just reading present data to actually predicting the future. By tracking p-tau217 levels over time, researchers discovered they can actually estimate the onset of clinical Alzheimer's symptoms with a median error of just 3 to 4 years. Think about that. This is a staggering leap from just diagnosing a disease that's already there to mathematically predicting its clinical arrival.
To put this into perspective and see why it matters, consider how this timeline shortens as we age. For instance, if a person has elevated p-tau217 at age 60, the clock predicts symptom onset in roughly 20 years. But if that same elevation happens at age 80, symptoms could appear in just 11 years. This gives us a highly personalized timeline for patients, and it's going to be an absolutely invaluable tool for clinical trials that are actively trying to prevent the disease from taking hold in the first place.
Which brings us to our final section, Part 6, Guardrails and Human Progress, the Human Element.
Because despite all this incredible cybernetic decoding of the blood, we have to bring our focus back to the very human reality of clinical practice. There is a massive clinical guardrail we absolutely cannot ignore here. Up to 30% of cognitively healthy adults have these positive biomarkers in their blood, but they may never actually develop clinical dementia.
And that brings us to the core rule of this entire revolution. Biological positivity does not equal a clinical diagnosis. People are vastly more complex than just their biomarker readouts. Having the proteins in your blood means the pathology is there, yes, but it doesn't automatically mean you have or will definitely get the actual clinical syndrome of dementia.
As the clinical guidelines forcefully emphasize right now, blood-based biomarkers are adjunctive tools that increase diagnostic certainty, but they should never replace clinical judgment. These revolutionary tests have to inform, but never replace, the nuanced human judgment of a real doctor looking at a real patient. Because relying strictly on the code of reductive biology risks mislabeling perfectly healthy individuals. False positives cause immense, totally unnecessary anxiety. That is exactly why patients require holistic evaluation, and why current medical guidelines dictate that if a triage test comes back positive, it still requires secondary confirmation, like a PET scan or CSF test, before any definitive diagnosis is made.
Still, even with those necessary guardrails firmly in place, we are witnessing an extraordinary milestone in human progress. We are rapidly moving toward a reality where routine blood work replaces invasive, painful lumbar punctures and incredibly expensive imaging as our first line of defense.
With the Alzheimer's code slowly being cracked by something as simple as a finger prick, it really leaves us wondering, as we continue to decode the brain's data stream, what other secrets of human health are waiting to be decrypted by a single drop of blood? Thank you so much for joining me for this explainer. Keep learning, and as always, keep asking questions.